Bismillahirrahmanirrahim. Assalamu alaikum. Ladies and gentlemen, thank you so much for joining us on this auspicious occasion of 22nd Annual Conference of Pakistan Endocrine Society. We'll start with the name of Allah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين.
I'll now request you kindly to stand up on your seats for the national anthem. Thank you so very much. I'm Dr. Niba Sayed. I'm consultant endocrinologist, Vice President Punjab of Pakistan Endocrine Society, and co-chair organizing committee for this conference. And I welcome you here in our annual conference. So now Pakistan Endocrine Society has always aimed for the excellence in academics, and each and every bit of this conference, it has a lots and lots of hard work for the PES and its own team, and it cannot have been possible without the untiring effort of Dr. Aisha Sheikh, who is the president, Dr. Ali Asgar, who is the president-elect, and Dr. Faisal, who is the finance secretary of Pakistan Endocrine Society, along with their team. So now, I will now request the president of Pakistan Endocrine Society, Dr. Aisha Sheikh, who is consultant endocrinologist in Aga Khan University. She's a recognized tutor at University of South Wales, United Kingdom, and obviously the president of Pakistan Endocrine Society, to kindly come on the stage for the inauguration speak.
Bismillahirrahmanirrahim. Assalatu wassalamu ala khatamin nabiyyin wa ala alihi wa sahbihi ajma'in. Assalamu alaikum wa rahmatullahi wa barakatuhu. It's my great pleasure to welcome all of you to 22nd Pakistan Endocrine Society's annual meeting. And it's been a wonderful experience and a great pleasure to have a crowd of this intensity sitting here in the hall. I'm really grateful to my teachers, Professor Abdul Jabbar, Professor Najmul Islam, Professor Atul Kalhan from UK, all my colleagues from Pakistan Endocrine Society, all the delegates, and all our corporate members for their kind presence in today's session. So I'll just walk you through to what we are doing in Pakistan Endocrine Society over last few months since we last met. So in May 2024, we had our Midsummer Updates meeting. That is one of the major meetings that Pakistan Endocrine Society holds in a year's time. From 17th to 19th May in Nathia Gali, we met, and there was a wonderful academic session along with a 5-kilometer walk and networking. So in the month of May, which is the Thyroid Awareness Month, Pakistan Endocrine Society held a lot of sessions, not only for our physicians, but for patient awareness as well. and you can see some glimpses from there. We had the webinars on thyroid disorders, which covered all the major thyroid disorders, and that those were mainly meant for our physician colleagues and family physicians, conducted by our own PES colleagues. So these are the public awareness videos and messages that were displayed on our social media platforms. We had some radio programs for general public for thyroid disorders, covering hypo and hyperthyroidism, thyroid nodules, and thyroid in pregnancy. These are again some glimpses of Thyroid Awareness Day messages, which were displayed on 25th of May. And then we held a Facebook Live session on thyroid awareness disorders. Similarly, there were radio programs conducted by our esteemed executive members and scientific executive members. Following this, this is another activity that Pakistan Endocrine Society is holding for our fellows in endocrinology who are in training. This is Endo Olympics, and this is a really exciting quiz competition that our fellows experience. We had the MOU signing with CCL Pharma, which is our partner in Endo Olympics, during midsummer updates, and that was followed by Endo Olympics competitions, quiz competitions across the 4 major cities of Pakistan, Karachi, Islamabad, Peshawar, and Lahore. And we are really excited to, looking forward to the grand final, which is on the third and last day of the current event, Sunday morning, 8 to 9 a.m. So you are all are welcome to witness that grand final of Endo Olympics. The winner will get a chance to attend International Diabetes Federation meeting next year. Endo Hub is another initiative that Pakistan Endocrine Society has taken since last year, and this is a collaboration between Pakistan Endocrine Society and a Smart Dog project of Gets Pharma. We had this MOU signing in early part of the 2024 January. And then there were Endo Hub competitions. So this Endo Hub program actually deals with clinical cases competition among endocrine fellows in training. And these are conducted across major cities of Pakistan. So we already have competitions taken place in Peshawar and Lahore and Karachi. So these are few glimpses from those events. Karachi competition here, and the winner from these Endo Hub competitions get a chance to participate and attend the ACE-MENA meeting that will be held in Dubai next month. Another initiative that Pakistan Endocrine Society took within last few months was this joint symposium between Pakistan Endocrine Society and Society for Pediatric Endocrinology and Diabetes, Pakistan. And we were thinking about this subject because this was something which was not covered very well within our medical community in last several years. So by the topic of demystifying puberty and pubertal disorders, we organized this insightful and comprehensive symposium that consisted of 2 webinars initially that actually dealt with the normal reproductive physiology of male and female reproductive systems, followed by the genetics and embryology of puberty and reproductive system. And this was then followed by a full-day symposium across major cities of Pakistan, Karachi, Lahore, Peshawar, and Islamabad. That was again jointly organized by Pakistan Endocrine Society, a Society of Pediatric Endocrinology and Diabetes, and dealt with pubertal disorders, both precocious puberty and delayed puberty. And that was followed by a very interactive workshop, and these were conducted by our esteemed executive and scientific executive members and members from Society of Pediatric Endocrinology and Diabetes. And we are grateful to Sami Pharmaceuticals for helping us arrange this full-day symposium. Again, these are a few glimpses from the event. And then we held a public awareness session on our Facebook Live session that was broadcasted on YouTube, PES TV, our YouTube channel as well. covering the topic of demystifying puberty and pubertal disorders, and that was very well taken up by our public. Another initiative of Pakistan Endocrine Society is this DEEP project, which is the diabetes education for every physician. This project was initiated last year under the leadership of Dr. Ibrar Ahmed, the past president of Pakistan Endocrine Society. This is actually a certificate program on diabetes management, and it is a self-paced learning program, 3 months duration, covering 6 modules. And this is a hybrid program where there is both synchronous and asynchronous online learning modules available. So we had one course completed last year, and this year the second course of this DEEP program is currently underway, and we are expecting it to be completed sometime in the end of October. Endocast is another project of Pakistan Endocrine Society where we have a healthcare podcast on endocrinology, and this is again an initiative taken by Dr. Ibrar Ahmed during his tenure. The season 1 was already concluded, and you have heard about season 1 in our last meeting. The season 2 is now being broadcasted on different platforms, social media platforms, and you can see some glimpses from the season 2, covering various aspects of diabetes and endocrinology. And Dr. Saima Askari and Dr. Uniba Sayed has played a very important role in concluding these endocast sessions. So some glimpses from the endocast. Again, we had an opportunity to discuss menopause for our general public during the month of June. And this was a very important session that was conducted as a Facebook Live session and is available on our YouTube channel as well for public awareness. And similarly, our session on type 1 diabetes, again, that was held sometime in June. Facebook Live session that is for general awareness of public on type 1 diabetes. That was very well attended by our patients with type 1 diabetes. As most of you know, that September is the PCOS awareness month. So polycystic ovary syndrome, which is something that most of our endocrinologists see quite often in their clinical practices, Pakistan Endocrine Society has taken an initiative for PCOS awareness during the month of September for last 4 years, and we have been conducting this awareness drive very successfully during all these years. And this year, Dr. Sumaira Jabin and Dr. Yaqub Khan led this awareness campaign with lots of activities that encompassed all the month of September. There were public awareness messages and information leaflets that were available on our Facebook page and our different social media platforms. Similarly, several awareness videos for public and patients from our experts on polycystic ovary syndrome. Public awareness messages like these where people are getting awareness about the condition and whom to contact if they have any such symptoms. Similarly, these messages are available both in Urdu language and English language. Again, we had almost a dozen workshops for healthcare professionals across Pakistan throughout the month of September. And these are some glimpses from those workshops in Karachi. And again, these are public awareness videos on polycystic ovary syndrome. And these are other workshops, glimpses from various cities. And we are really grateful to FAMIVO, which is our corporate member, for supporting the PCOS awareness campaign each year. And they did wonderfully this time around as well. These are again few glimpses from the polycystic awareness campaign. Then radio programs which were held in Lahore and Karachi and covered various aspects of PCOS. Dr. Fahmida Farooq and Dr. Saima Askari, you can see both of our executive members talking about polycystic ovary syndrome with at the radio program. And then we had 3-session public awareness program on our Facebook Live session as well, which dealt with various aspects of PCOS, right from diagnosis, management of common symptoms, management of infertility, and similarly long-term complications. We invited experts from other departments like gynecology and dermatology and nutritionists as well to participate in these events so that we can spread the message that polycystic ovary syndrome needs a holistic approach in management. Another initiative that Pakistan Endocrine Society has undertaken is for its own executive and scientific executive members by the name of Clinical Trial Proposal Endo Grant, which is supported by Getz Pharma. And this is a clinical trial grant that is available to our members. And they have sent their application, and these will be discussed in front of the jury, and the grant application will be then selected based upon the relevance and the importance of that grant application in the Pakistani context. This is the MOU signing ceremony. So the importance of inpatient hyperglycemia management cannot be overemphasized when we are managing our patients with diabetes in the inpatient setting. Realizing this importance, Pakistan Endocrine Society held a 2-day webinar on hyperglycemic emergencies that covered diabetic ketoacidosis and hyperosmolar state and inpatient hyperglycemia management, led by our scientific executive and executive members. And the course was actually designed by Dr. Azra Rizwan, who is the VP Sindh. Diabetes Prevention Program, PAC DPP, about which you are listening about this diabetes prevention program for last couple of years. And we are excited to share with you that we will be having a dedicated session on PAC DPP on Saturday, that is tomorrow, 12th October, 4:45. So it's a welcome note to all of you that you have to kindly participate in this session so that you get the update on PAC DPP project. Pakistan Endocrine Society had its presence at the Celendo 2024, which is the Sri Lankan Endocrine Conference. Dr. Musarrat Riaz and Dr. Sidra went to participate in the conference on behalf of Pakistan Endocrine Society, and they are part of the obesity group that is working from the SAFI's platform. And you can see their names, and we are really proud of them that they are part of the Asian Journal of Obesity as experts from Asia. This is something that we shared in our midsummer meeting as well. People with adrenal insufficiency, they need some kind of identification on them all the time so that when caught in an emergency situation, they can be administered injectable hydrocortisone in a timely manner, which can prevent an adrenal crisis from happening. These are the medical alert cards and bracelets, and these are available at Pakistan Endocrine Society stall. And you can take those for your patients from there and give those to your patients who have adrenal insufficiency and guide them that they should be wearing those bracelets all the time and should be having their bracelets, their identification card, steroid alert card available with them all the time. This is the list of Pakistan Endocrine Society publications: thyroid disorders in pregnancy, PCOS, which is the clinical practice guideline for practical guide for healthcare professionals. Similarly, this is our latest publication, which is a practical guide for physicians for endocrine test protocols. This is relevant to our population and our availability of the tests that are available for our use in Pakistan. And then this is our latest newsletter, which you will all be getting in your conference bags. So you can grab the copies for yourself from the Pakistan Endocrine Society stall. And then there is another announcement that, inshallah, tomorrow morning we will be having the launch of the pituitary adenoma guidelines during the pituitary session. So we invite all of you to that session as well. So just yesterday, we completed the 10th endocrine board review that is for our endocrine fellows in training. This is a regular activity that is happening as pre-conference activities of Pakistan Endocrine Society. And our fellows highly regard this activity, and I'll be sharing its origin today, inshallah, at some time. Okay. So most of you have been our regular attendees, and I have met people who attend each and every conference that Pakistan Endocrine Society holds. So my request to all of you is that please strengthen Pakistan Endocrine Society by joining Pakistan Endocrine Society. We have the membership forms available at the society's stall right next to this hall. And even if you look at the Pakistan Endocrine Society's new website, there is a membership area where you can actually apply for membership online as well. So my special thanks to all our corporate members. I think that few of your logos might not be here, but without your support, we cannot actually achieve all these academic ventures and research activities and different academic activities for our fellows in training. But on the same end, we feel that you get benefited from being part of the Pakistan Endocrine Societies, and you know it very well if you compare what you are getting from PES compared to other societies in Pakistan. The difference is actually always there. So thank you very much to our corporate members for helping us through all these years and strengthening PES and its activities. And I'm really grateful to all of you, all our executive members, my cabinet, the board of governors, all scientific members, all the delegates who are here, our international speakers, and our administrative support, Muzammil Saab and your team, Harun, thank you very much. So thank you very much, and I'm looking forward to exciting 3 days of learning. Thank you very much. Assalamu alaikum.
Thank you so much, Dr. Aisha, and it seems as if we are on the right track, and inshallah we'll be doing a lot more than that. And I take now immense pleasure to invite Dr. Richard Quinton, who is a consultant endocrinologist in Newcastle on Tyne, UK, and honorary reproductive endocrinologist of Imperial College of London. And he has graciously accepted our invitation to PES 2024. Thank you so much, sir. And he will be giving an overview and an introduction for the Society of Endocrinology UK. Thank you so much, sir, for coming here.
So thank you so much for that generous introduction. So this is my second time in Pakistan. The last time was in Islamabad, 2016, when both Professor Ali Jawa and I still had darker hair. And the welcome here has been extraordinary, and this city is just, City of Eagles is so beautiful. So I'm here representing my own national society, although it has international vibes, the Society for Endocrinology. And I sit on their Events and Training Committee. The SFE, that committee is frequently asked to review and examine external events, so external educational events run by other groups, and to consider whether we should endorse these meetings. And the criteria are there should be at least one member of the SFE involved in generating the scientific program, that it should be a high quality program, and that it should not clash with an existing SFE event. So, the Pakistan Endocrine Society 2024 is the very first time that SFE has endorsed an external meeting which is actually that of a national endocrine association, and for the first time. And actually they bent their own rules, because in fact the SFE and the Irish Endocrine Society are currently having a joint meeting in Belfast right now, so this notionally clashes. So theoretically, that should have been like a scratch through. But I think that the quality of the event was clearly so high that this condition was waived. And I do hope that there will be deeper collaborations in future between PES and SFE. Many people here, I think, some people here are possibly members of even both societies, working between the UK and Pakistan, trained in one place, working in another place, and hope this will be a future fruitful collaboration in years going forward. So again, many thanks for this invitation. Many thanks for having reached out to SFE in the first place. It's wonderful to have seen faces of so many old friends here, and also to have met some new friends since I've been here. The young ones here, you wonder, well, what is science for? And clearly, it is about moving boundaries forward, improving patient care, improving our understanding of the human body, how it works in health and disease. But the other thing that I've come to realize over the years is that one of the most wonderful things about being involved in research is the people. It's like the friends you make, the people you meet as part of the journey. So many thanks to you, and I look forward to enjoying the rest of the conference. Thank you.